Hello and welcome. My name is Cara Miller. I'm one of the many radiation therapists who will deliver your radiation therapy. To enhance the quality of patient care, we've produced this educational video to help people with cancer and their families. At the end of this DVD, commonly asked questions will be displayed at the end of the screen. If you have any further questions, please bring these with you to your next radiation oncology appointment, where a member of staff will be happy to spend time going through these questions with you prior to your treatment. At the end of this DVD, a list of useful contacts will also be displayed. The aim of this video is to help people with cancer, their family and friends, to have a better understanding of what radiation therapy is. It is not meant to cover everything, but to give an insight in what to expect when having radiation therapy. More importantly, it aims to point people in the direction of people, organisations and sources of information who can give you further help and support.
One in 3 people will be affected by cancer at some stage in their lives. There are over 200 types of cancer. All start in the same way. The control signals in a normal cell in the body go wrong, resulting in abnormal cells forming a lump. This cluster of abnormal cells is called a tumour. Some tumours are benign or harmless and often don't need treatment. But malignant tumours do need treatment. They may be dangerous because they can invade nearby parts of the body and stop them working properly. Cells from malignant tumours can break away and travel to other parts of the body where they can form new groups of abnormal cells called secondary growths or metastases. The causes of cancer and how quickly the cells grow or spread may vary from person to person. It is important to remember that a large number of people with cancer overcome the disease and lead fulfilled lives for many years. When an abnormality is suspected, you may have had one or more of the following types of diagnostic tests: a biopsy, blood test, X-ray or scans. Waiting for test results or waiting for appointments is often a tense time. But remember that there are people and organisations that can give you support before and after a cancer diagnosis is confirmed. Doctors, radiation therapists, nurses and other members of the healthcare team will be helping you through your treatment. It may be hard to take in everything at once, so do ask the staff questions and don't be afraid to repeat them if you forgot or didn't understand what has been said. Not all hospitals can treat cancer with radiation therapy, so you may have to travel to a specialist cancer centre to receive radiation therapy. This DVD shall look at the patient journey through radiation therapy. Treatment. The main types of cancer treatments are surgery, radiation therapy and chemotherapy. Radiotherapy is a means of treating cancer using high-energy X-rays, and it is painless. It feels no different from having a normal X-ray picture taken. The X-rays work by destroying any cancer cells in the problem area. Normal cells in this area are also altered. However, they have the ability to repair themselves quicker than the cancer cells. The damage to these cells is what causes temporary side effects during and after treatment. Radiation therapy is used to treat cancer in 3 different ways. Radical means to cure the patient of the cancer. Palliative means to relieve the symptoms caused by the cancer. Adjuvant means having a combination of many treatments such as chemotherapy and radiation therapy and/or surgery to cure the cancer. Consultant appointment. In order to plan your treatment, your specialist doctor or radiation oncologist will take into account the particular type of cancer you have, its location, extent of disease spread, your general health, and any treatment already given. The radiation oncologist will discuss with you the best course of radiation therapy treatment to give. Although doctors' time may often appear busy, it is important you do not feel rushed when you are with them. It is important that you ask for an explanation if there is anything you don't understand. Bring a friend or relative to the consultation and make notes before, during and after your visit. Written information will be given to you to accompany what the doctor has told you. Treatment is planned differently for each individual, but most people will follow one or all of the planning pre-treatment procedures you are about to see. These include CT, simulation, and mold room. Mold room. The mold room is an area for making a mask that is fitted over the face during treatment. You can breathe as normal at all times in the shell and keep your eyes open or shut. Depending on the treatment site and type of cancer, one of the following masks may be chosen. A clear perspex shell, also known as a beam directional shell or BDS, or a plastic shell, also known as an orphid. An orphid comes in the form of a piece of stiff plastic sheet. The material is placed in warm water, which softens the material, allowing it to be placed over the face and stretched, forming an impression. The radiation therapists are present during the whole procedure.
Cooling it down now with some cold paper towel.
A BDS is made from plaster of Paris bandage, the same material and process used for casts on broken bones, arms, etc. Lukewarm, wet plaster of Paris bandages are then placed over the face and neck area to form an impression. Your nose and mouth will be kept free of bandages at all times. The bandages will be left in place for 5 or 10 minutes, and once they've hardened, they will be removed. When you have gone home, the radiation therapist will fit the plaster to make a clear plastic shell. Any necessary dental work should be completed prior to this planning procedure, otherwise it should be left until after the treatment is complete. No dental work should take place during treatment. The radiation oncologist will discuss this with you on your first appointment. CT. A CT scan takes an X-ray picture of the body to view the tissues and organs. The machine looks like a donut and is situated in a large, open, airy room. The radiation therapists transfer the images taken into a computer to initially plan your radiation therapy treatment. At this stage, tattoo markings, permanent ink marks, are placed onto the skin. They are used to ensure the accurate delivery of the radiation treatment on a daily basis. This CT process takes approximately 15 minutes. After having a planning CT scan, you may be given an appointment to return to the department to check the plan produced or to start treatment.